Looking into the vertebrae, there are different regions along the vertebral column that have different types of vertebrae, from the cervical vertebrae to the thoracic vertebrae to the lumbar vertebrae to the sacrum and the coccyx. But before we get into each individual vertebrae style, we have to look at what the main features are of a vertebrae. Now, this one happens to be a lumbar vertebrae. I'll use this just because it's larger and it's easier to see some of the features. The first thing to take note of is orientation. This body is anterior. This point back here, this spinous process, is posterior. So posterior, anterior. Now the body here looks larger on this vertebrae because the lumbar are lower in your back, they take more weight. So they have to be bulkier and larger, more mass to take this weight. So the body. Everything off the body, this whole entire arch, that's known as the vertebral arch. What we need to do is go through some pieces on the vertebral arch. But one thing before we get there, you can see this hole right here. That's where the actual spinal cord and the spinal nerves will run. That hole is the vertebral foramen. And every one of the vertebrae is going to have this vertebral foramen because that's where your spinal cord is. All right, back to the vertebral arch. The first structure, this base part right here, so this area and this area, is known as pedicle. The pedicles are the bases, the parts that build the entire arch. Think pedicle like a pedestal. A pedestal is something that raises up. You put something on a pedestal. The entire vertebral arch is put on these two pedicles. So this structure right here, if you went all the way around it, is called a pedicle. From the pedicle, notice these 2 points are sticking out. Those are known as the transverse processes. Each one is a transverse process. They're aiming out laterally. From the transverse process, we go to this area here and this area here. Those are known as the lamina. So we go from the pedicle, transverse process, lamina. And the last thing is this point going off here that's going on the posterior side. That point is going to be the spinous process. So this spinous process is posterior. If you're running your hand along your back, along the vertebral column, that's what you're feeling. You can palpate your spinous processes. So going in order, body here, pedicle, transverse process, lamina, spinous process. And the same thing on the other side. But there are 2 other structures that also need to be mentioned. We have superior articulating processes and inferior articulating processes. Now, right now, we're looking at a superior view, if you're looking down the vertebral column. So these pieces up top, right here and right here, those are the superior articulating processes. Each superior articulating process is named because it's going to articulate, form a joint, with the vertebrae above it. So if there was a vertebrae sitting up here, it would articulate with these 2 points. That's what would touch. The actual bodies wouldn't touch. There would be cartilage in between the 2 bodies. Instead, we have these superior articulating processes would articulate with the vertebrae above it, and it's that vertebrae's inferior articulating processes. Now let me reset this so you can see the inferior articulating processes. All right, now I've reset to a lateral view. The reason I'm showing you lateral is if you do this, you can still see the superior articulating process. But if I rotate under inferior, you see right here and right here. These are the inferior articulating processes. They're coming off the bottom. Now, because of their joints, they're nice and smooth. So here's one, and here's the other one. Inferior articulating processes. Rotate back through lateral and superior. You now can see the superior articulating processes. Now we've finished going through the generalized features. Let's look at each of the three main categories to focus on: the cervical, thoracic, and lumbar. Now that we've reset, you can see the three different vertebrae and their proportional size differences. This is going to be a cervical vertebrae. In the middle, we have the thoracic and the lumbar that you saw previously. So let's go through this cervical vertebrae first because it has some unique features. Still has everything we talked about from that general feature list, but there's a few that are only found on the cervical vertebrae. Now that we have just the cervical vertebrae here, you'll notice it still has the same features. It still has the body, still has the vertebral foramen, still has the vertebral arch, still has the pedicle, transverse process, lamina, spinous process. But what's unique is the cervical vertebrae also is going to have these transverse foramen here and here. There's extra holes, and that's one of the big giveaways for the cervical vertebrae. Only cervical vertebrae have these transverse foramen. Another unique feature that you'll find is the spinous process can have 2 points, referred to as a bifid spinous process. So that's another unique aspect of the cervical vertebrae. And the body itself is going to be the smallest of all the vertebrae. But now, the first 2 cervical vertebrae are also more unique in their structure. This is what cervical vertebrae 3 through 7 would look like. So let's look at cervical vertebrae 1 and 2. Here we have cervical vertebrae 1 and 2. This is cervical vertebrae number 1, known as atlas. This is cervical vertebrae number 2, known as axis. What you'll notice about atlas, the vertebral foramen is much larger. This is what will articulate with the occipital condyles on your skull. So pretty much your skull sits on this first cervical vertebrae. So this is going to be atlas, cervical vertebrae number 1. Cervical vertebrae number 2, which is axis, is going to have this point coming up here. Now if we pick this up a little bit, you'll see that point up top. This point is known as the odontoid process, or the dens. So that is cervical vertebrae number 2, axis. Cervical vertebrae number 1, cervical vertebrae number 2, axis and atlas. Now let's take a look at the thoracic vertebrae and what's unique there. Now that we've changed perspectives and we can see the thoracic vertebrae, we're looking at a lateral view here. Now, in this lateral view, we can see this downward pointing spinous process. So the spinous process is still on the posterior side, but you'll notice it's angled downward now compared to the cervical or the lumbar vertebrae. So that's one of the unique features. A second unique feature are going to be the facets for the ribs. Because the thoracic vertebrae have the rib cage, you're going to have locations on these vertebrae where the actual ribs are going to form an articulation. That hence the facets. Now, most of the vertebrae are going to have this facet right here on the transverse process. So you have one of the facets right here on the transverse process. So all of the thoracic vertebrae except T11 and T12 have that. Otherwise, though, you have 2 more facets. You're going to have this inferior facet right here this inferior costal facet, and then you're going to have this superior costal facet right here. So right in the top, just in the body, right where the vertebral arch starts, that is the superior costal facet. This is the inferior costal facet. Then you still have this facet, as I mentioned, up here on the transverse process. But all three of those are facets for the ribs, just different places that they're articulating. So that's what we're looking at for the unique features of the thoracic vertebrae. Next up is the lumbar vertebrae. Now to reset, this is a superior view of the lumbar vertebrae. We've already talked about this pretty extensively when we went through the general features. Just keep in mind, larger body, because more weight, and much bulkier on the vertebral arch. That's for more muscular attachment. All right, shifting into the sacrum then. Now here we have the sacrum and the coccyx. This is an anterior view. The sacrum itself is a total of 5 fused vertebrae. This little piece down here is the coccyx. On the sacrum, you can notice these holes. Those are the sacral foramina. The sacral foramina. While the sacral promontory is what you're looking at right up here. The sacral promontory. So sacral foramina, there's a couple of those here and there, and then sacral promontory. As I mentioned again, this part down here is the coccyx. A lot of times you might hear it as called the tailbone, but this is the coccyx. And that's going to have a lot of times 3 or 4 vertebrae that are there, but sometimes can have a few more depending on anatomical variation. So look into the vertebrae and their different features and landmarks.